We're in conversation with Dr. Shyam Bishen, the head of the Center for Health and Healthcare and member of the Executive Committee at the World Economic Forum right here in Davos. Thank you very much, sir, for talking to Money Control. I want to start by asking you, I remember last year at WEF, the WHO chief director general raised an alarm on a potential, disease X pandemic that could be 20 times deadlier than COVID-19. Since then, we've seen an Mpox outbreak in Congo and an HMPV virus outbreak in China. What should the world prepare for from a pandemic point of view in 2025?
Thank you, Chandra. Thanks for having me on your program. It's a pleasure to be here. You are absolutely right. Last year we did talk about an unknown pathogen coming again in the future, and you see that this will increase as we see the impact of climate change, as we see more and more extreme weather events, global warming. I think new pathogens, new viruses will become a part of our living on this planet, and we want to make sure that the healthcare systems are well prepared for that. What do I mean by well-prepared healthcare systems? Meaning that, there is access to primary care centers, there is access to healthcare products and services around the world, not just in developed countries, but also in global south, in low and middle income countries. And there are access to, vaccines, diagnostics and treatments. And this is what we are preparing for, So there are two things that the World Economic Forum is doing in this area. One is we launched an initiative called Bridge, which is about disease intelligence. We want to make sure that there is a good pathogen surveillance, and the data is collected at the global level and it's shared at the global level with both public and private sector, so that the systems can prepare to launch diagnostic, to launch vaccines and treatments as soon as possible. We don't want nations to hoard data. We don't want a private company to hoard data. And for that, we need to build a global system for intelligence. We need to build a global disease intelligence system. And now AI can help in that area. So we are working with both public and private sector, with WHO, on this disease intelligence initiative. The second part is we are working on the regional manufacturing capacity, building regional manufacturing capacity. As you saw last time during COVID, some nations, some regions were very good in terms of manufacturing and in terms of accessing vaccines, and also inoculating their citizens quickly, whereas we had lack of vaccines in many parts of global south, especially in Africa. And so we want to make sure that we have vaccine manufacturing facility as one example, even the diagnostics and others around the world, even in regions like Africa. So we are working very closely with WHO, with African governments, and with manufacturers, with private sectors to do just that. So we have an initiative called Regional Vaccine Manufacturing Initiative, or Regional Vaccine Manufacturing Collaborative, that's working on that. So it's things like that that we need to make sure that we bring both public and private sector together to solve for some of these challenges and prepare the health system for what's coming. We know that climate change will have an impact on human health, will create more challenges for us. Unless we prepare our health system, we are not going to be able to respond to that.
Right. Talking about weather and climate change, in India, one of the key health risks is coming from pollution. In fact, by some estimates, breathing in Delhi's air on a day in November last year was equivalent to smoking 27 cigarettes. What can India do? What can we learn from Beijing, which countered, similar problems in the past with poor AQI?
Yes, I think that's a good example. Unfortunately, it is true that during winter time every year India faces this challenge, and this year was pretty bad. But you gave the example of Beijing, where it used to be a huge problem. The air quality was really bad, especially before 2008, before Beijing Olympics. But China was able to manage that and control that through many public sector initiatives. Through making sure that there is a good education for the public, They understand, public understands that this is something that they have a big part to play in. It's not just the government. Government is not going to solve all your problems. So making sure that, there is a good education, what to do and not to do for the public. Making sure that the government is providing incentives. So, for example, in China, in Beijing, the government of China provided a lot of incentives to both private sector as well as to individuals, to people living close to the city or in the city, not to use coal, for example, not to use fuel that is creating pollution. So I think government incentives are really important, but also in terms of the educating the public. That's again a key should be a key focus area for Delhi. So I think there are many other things that the government of China did in Beijing, and there is a good roadmap that India can follow for Delhi and other cities.
Right. Also, sir, in terms of AI itself, you mentioned before on AI and its potential. Has it moved from actual hype to impact in healthcare? Where is it being actively used? I think OpenAI a couple of days ago spoke about a bioengineering initiative, for example, that they are pursuing, which seems very exciting. But beyond that, where do you see the scope for AI? And will we also see AI agents taking off in healthcare?
Yes, that's a very good question, Chandra. Actually, AI, I believe, has a huge potential in healthcare arena. Healthcare is about knowledge. Healthcare segment is based on knowledge, using knowledge to discover new drugs, to develop new drugs, using knowledge to diagnose diseases, using knowledge to treat diseases as well as on the delivery side. And AI is all about knowledge, knowledge activities. So I think AI has a huge potential to transform the overall healthcare, not just incremental uses, but can completely transform the healthcare. It's already happening. You already see that AI is being used in diagnostic area for breast cancer diagnostic, as well as TB and other diagnostic areas. AI is being used in drug discovery and development. You saw Google's DeepMind getting a Nobel Prize exactly on the AI side, using AI to look at protein folding and how it can help on discovering new drugs. So AI has a huge potential here, and I think India has a huge role to play here. India has already started working on this. India's digital healthcare infrastructure is providing a good platform for private sector to get engaged on the innovation side. The area where Ayushman Bharat Digital Mission, Ayushman Bharat health care accounts, those are providing good infrastructure for private sector, for innovative companies to look at the overall digital health, which includes AI. To transform the health system in India, but I think it can also be taken out of India, brought to other countries, especially Global South, and we see quite a few examples happening now. AI is being used, for example, in the rural areas, even in the telemedicine, in the telehealth areas, to reach to people that you couldn't reach before. So I think there is a huge potential here for AI in healthcare.
Right. In fact, I was just coming to that. How can India play a role in terms of taking the Ayushman Bharat mission and its experience in scaling digital public infrastructure? We've already seen a huge impact of that in, boosting digital payments, financial inclusion, direct benefit transfers. How can that be replicated in healthcare, and how can that be exported globally?
Yeah. So that's what we are working on actually right now. We have a partnership with governments in India, both the central as well as state level. And we have partnership with private sector. So hospitals like Apollo Hospital, some of the pharmaceutical companies, where we are looking to see how we can use health data. Health data is extremely important when we talk about AI. AI is nothing without data. And fortunately for people working in healthcare segment, there is a lot of health data. Data is not a problem. The problem is access to good quality health data. Problem is making sure we can solve for silos in health data. There are interoperability challenges when you talk about access to health data. How do we solve for that? This is what actually we are working on. We established a Center for Fourth Industrial Revolution, what we call C4IR in Hyderabad. This is in a collaboration with the government. This is in collaboration with private sector to look at some of these things. How do we solve for data challenges? How do we then make use of AI to again scale up some of the healthcare solutions? Whenever we talk about healthcare challenges, I talk about three things. Access is number one, where we want to make sure that good quality healthcare is accessible to people around the world. Second one is outcome. We want to make sure that we don't just provide access, but that access is with good outcomes. So good healthcare, good outcomes. The third one is on the efficiency side. We want to make sure we gain operational efficiency. We want to make sure that we cut down the cost of healthcare delivery, cut down overall healthcare cost. Because as you know, the healthcare cost is over $12 trillion now. That's almost 10% of the global GDP. And it's growing at almost a double-digit rate. We can't continue on this path. If we continue on this path, it will be $25 trillion by 2040. That's unsustainable. But we believe that AI can help us cut down that cost. It can help us cut down on operational cost, cut down on drug discovery and development cost, cut down on the delivery cost. So there are three things, we think that AI can help on the access side, on outcome side, and on the efficiency side. India and some of the other developing countries, they have an opportunity here to leapfrog on the healthcare side. You mentioned on the finance side, on the telecommunication side, this has already happened. And India has the infrastructure that can be used to, again, leapfrog on the healthcare side, similar to what India has done on the financial side and on the telecommunication side. Not only it can be done in India, it's being done in India, actually, it's already starting, but it can also be transported to other parts of the world. We have an initiative in my center called Digital Healthcare Transformation. In that initiative, we are launching some activators around the world. India will be one of those places where we launch this activator together with government and private sector, looking at just that. How do we scale up some of the early solutions, some of the early signs of success? When we talk about AI in healthcare, how do we scale up? But not only scale up, but how do we make it global?
Right.
So our initiatives are global initiatives where we bring in global exchange of ideas, global exchange of initiatives, but we go beyond that, where we are also looking at how do we build local healthcare ecosystems which can help implement some of the ideas, and then not only implement but pilot those, they scale those up, and then take those to other regions and other parts of the world.
Right.
Yeah.
Finally, sir, a lot of these anti-aging movements are gaining ground. There's a famous person called Brian Johnson, an entrepreneur turned person of the Don't Die movement, who talks about, plasma therapy and taking over, 50 supplements a day to reverse the aging process. Do you subscribe to these things? Do you think it can really work? What's your view?
Yeah, these are early days. These are early days in that area when we talk about longevity, when we talk about healthy lifespan. In my mind, a healthy lifespan is more important than longevity. Right. I don't want to live to be 200 years old, but 100 of that years I'm diseased. Yeah. So I think we want to avoid diseases, and for that, prevention is the key. We do focus on health and wellness, where we are looking at how do we make sure that we use food as medicine, basically. We use food to prevent things, so we use other things, lifestyle, exercise, and other things to prevent diseases, Obesity, for example, is a huge curse. It's growing very fast. Almost half of the US population, somewhere between 40 to 50%, is obese. More than 60% people are overweight. And this is not just a developed world problem. It's happening in India, it's happening in China, it's happening in Middle East, in many parts of the world. How do we make sure that people are aware, to avoid this? Some of it is genetic and it's difficult, but people can still take measures by eating more nutritious food, by eating food that's healthy, and also exercise. So I think the lifestyle changes are more important than looking at something that's more shiny, whether it's plasma therapy or it's a gene therapy. I think they have their place, and they will, over time, will be tested more and more. And some of it will be valid and applied, but some of it will not be, used, and it will disappear. But to me, it seems like making lifestyle changes. I mentioned obesity. The second one in my mind is tobacco control.
Yeah.
So tobacco, smoking causes many diseases, from cancer to cardiovascular and other diseases. I think that's I would say the second biggest cause of disease death. So tobacco control, the government should pay special attention to that. Make sure that tobacco is taxed properly, taxed heavily, and then the tax money is being used in the healthcare side to take other measures. So I think in terms of the lifestyle, in terms of staying away from tobacco, staying away from alcohol, in terms of making sure that you're eating nutritious food and you are exercising, those things are much more important when we talk about aging, we talk about healthy lifespan, and we talk about longevity.
Great. On that note, thank you very much for talking to Money Control.
Thank you.
Thank
Thanks
you,
so much,
Dr.
Chandra.
Bishen.